Hello guys, and welcome back to a brand new episode of the Double A Show. My name is Ajay Singh alongside my co-host
Alex. And today we are here at the Fisher's vaccination spot. It was created recently to help vaccinate the community here in Fishers. So our first question to Director Heltz is sort of how did you get your start in public health, and how has it led you to becoming the public health director here in Fishers, Indiana?
Yeah, that's a great question. So when I went to school, I didn't know anything about public health career. I went to college for biology and chemistry. I joined the Peace Corps, so I've always had a heart for service. My parents were Peace Corps volunteers before me. And when I came back, I found a position working with environmental children's health in Indianapolis with the Improving Kids Environment group. And that was my first introduction to public health as a field. I found that really spoke to me and my ideals for service and how to serve my community. And I needed additional training, so I went back to school again for nursing and for public health, and really found the combination of skills that I felt were most valuable in giving back to my community, some practical skills that I could use every day. And then public health is a systems thinking field, and so similar to environmental field in that respect, but I had directly applicable skills that I could use every day. So I really have enjoyed being in public health nursing specifically. So I've had a lot of different jobs as a public health nurse in a couple of different states, but since moving back to Indianapolis, or to the Indy region, I worked for the Marion County Health Department for 10 years in a variety of different programs. Control program, the nursing program, and the Bellflower Clinic. While I was working on additional education, I'm a lifelong learner. And when I heard that the mayor was creating the health department, I thought, this is really where kind of all of the skills and experience that I've had may come together, and I may be able to serve my own community because I am a Fishers resident as well. So it seemed like I had something that I might be able to offer my community, and the mayor agreed, so here I am.
And that's very interesting to see because the Fishers Health Department is very new and it was just created. And this question might be kind of going off topic from that, but do you have any future plans working for bigger organizations such as like the CDC or anything like that?
That's something that people have asked me for a lot of years, well before I came here, just because I think when people see ambitious people, they assume that they want to work at a federal level or something famous like the CDC. I personally feel like local public health is the most exciting place to work, where you can actually see the direct impact that you have in your community. And again, I think I mentioned that I like being a nurse because I feel like I have practical skills that I can put to use every day. And if you're in an organization like the CDC, you don't actually get to do all that fun stuff.
Yeah.
So I think that's, that being able to go into the community and really know the community organizations, and especially to be in my own community, that's a lesson I learned from the Peace Corps, is so important to be able to be effective at doing anything. So this is where it's at for me. Like, I love local public health, and this is my passion. So.
As you know, COVID-19 has really impacted all of us, and I looked at the Fishers Health Department's website. Though decreasing, we're still in the significant category.
Yeah.
And we're essentially going on 2 years of this pandemic. So what do you think are the right steps we should take as a community to combat this pandemic?
So the best step we can take is vaccination. Our vaccination site is active. You may be able to hear it behind me. So we're excited to open up a new group with the 5 to 11-year-olds getting vaccinated because that moves our community a bit closer. We're better positioned than most communities just because our vaccination rates are much higher than what we're seeing around us, but we're not there yet. We still have cases every day. We're still testing 200 people a day. We've lost 121 Fishers residents to COVID. So we're still in the middle of a global pandemic. Things are still uncertain, but vaccination is our best and most concrete step that we can take to move our community forward. And I think we're seeing that we're feeling a little more comfortable day by day going forward with that. Our rates are still quite high, so we really depend on our community kind of jumping on any remaining members that still need vaccinated. I would encourage you to come out and get vaccinated as soon as you can so that we can all move forward together.
Yes, so because that's one of the things that we do on the show. We like to encourage the vaccination, and a lot of kids are at school. I encourage them to be a good citizen, get your vaccine, do your part. And recently, the federal government just announced like a vaccine mandate for all companies with 100 employees or more. What are your thoughts on this mandate that they're about to have?
Well, there's a lot of ways to get things done, and mandates are one way, and they are a very effective way at achieving that goal. I'm not going to speak to the politics involved
Yes.
of how things are done. I think we've learned a lot about that throughout this pandemic, that sometimes the best way isn't always the way that's to be the smoothest.
Yeah.
So although that's an effective tool to get vaccines to happen, it's certainly much better if people understand why it's important to get vaccinated and they can choose on their own. That's a much more effective tool for the long term, to say, I choose this for myself and my family because I know that this is going to help my community move forward and protect everyone around me.
Yes.
So I do want to encourage everyone to consider that, because really we are in this together, and it does take all of us kind of moving in the same direction to move forward.
Yeah, and in addition to that, we've seen a lot of conspiracies going on about COVID-19 vaccines. I think one of the conspiracies was that if you got the vaccine, you could stick your phone to your arm because it essentially magnetizes your phone. So seeing all of these conspiracies happening, the spreading of conspiracies, what are the steps we should take as a community to combat them?
It's frustrating as a public health official and as a person who has been in a scientific career, or scientific field my whole career, to see the lack of understanding of how science works, and I think social media, unfortunately, provides a good breeding ground for some of those conspiracies, as you say, because it gives everyone kind of a platform, which is part of the scientific process too, to test all possible theories. But when you come out with recommendations and guidelines, which is what the CDC does and which is what the scientific communities do, the American Academy of Pediatrics, all of those agencies, those are based on a preponderance of evidence, not one outlying evidence source. So it's important that everybody kind of understand that process and how to vet the materials that they're getting and the validity of the websites and what they're basing those studies are on. Anybody who's been trained in science learns to see how different studies are conducted and what makes a study more valid than others. And you can rank studies based on how likely they are to give you the evidence base that you need.
Yes.
And guidelines are produced on that with a lot of input. So that's why, we follow the guidelines that are produced, because we know and we have an assurance that there are a lot of agencies behind that, and that all of the necessary, compiling of evidence has been done, rather than pulling out one study that may, support a hypothesis that ends up not being true. So study your science fair research, those things are important. The scientific process is a process, and sometimes it disproves things and sometimes it proves things, but we work on the preponderance of evidence, and as the evidence changes, then the guidance changes, and that's what we've seen happen in action throughout this pandemic.
And kind of going off of that, with COVID being currently changing and always changing, we've seen like the incorporation of booster shots, which is like a new thing, and a lot of the people don't understand what it exactly is. Can you kind of elaborate what the booster shots are?
So booster shots are very common in immunizations. Anybody who's been immunized throughout their life has likely had booster shots. One very common example of this is the tetanus vaccine, which you are recommended to get. Once you're an adult, you're recommended to get it every 10 years. Before that, you have a series of them, before you hit your 12-year-old shots or your 6th grade shots. So this is just like an injection that helps your immune system remember, what it is it's supposed to be reacting against. So it's kind of a waking up to your immune system of something that it's got the power to do, but immunity wanes over time. So it decreases over time. And the booster vaccines are really to kind of just say, okay, wake back up, just in case you see this again. Here's your reminder of what that looks like, so that you can be ready. It's very common. If you look at any vaccine schedule, you'll see that almost every vaccine has more than one in the series, and that's why we call it a series.
So yeah, going past the COVID-19 pandemic, COVID-19 overall, what are some of the health crises or public health crises you see happening in Fishers besides just the COVID-19?
Well, I hope there won't be any crises. It's my job to prevent them. So that's my goal, is to prevent any kind of crisis. But we do active monitoring and surveillance of different kinds of things. You know, unfortunately, I think we're going to be living with COVID for a very long time. Hopefully not at this level, but you know, eventually it'll be wrapped into our kind of normal way of life, along with flu. That's something that we have to live with every flu season.
Yes.
I think the ability for viruses to spread like COVID has and become a worldwide problem is just going to increase as we talk about climate change and habitat loss and just the mixing of populations. So we do expect that our next pandemic will not be 100 years from now. We expect it certainly to be sooner, and we've seen little blips of those previously with MERS and SARS and all of those other things. So we definitely want to be ready for this scenario again, and you know, we've certainly learned a lot throughout this. Climate change, I think, is a really big issue, and we may not see that directly so much here in Fishers, but it has effects, and the ripple effects are everywhere. So from a public health perspective, we worry about that because it can trigger a lot of health problems like asthma, as we talk about particulate matter in the air, and heat. As the air gets warmer, then we worry about people having heat exhaustion and then the storms that it breeds. You know, so the propensity for larger storms and disasters and that kind of thing. So we have to be ready kind of from an all hazard standpoint. So we do work with our police and fire, first responders, and the Hamilton County Emergency Management Team to make sure that we have systems and structures in place. So from an emergency standpoint, that's kind of how we approach it in public health. But again, hopefully we're doing everything we can to prevent it. But again, climate change is such a bigger issue, we may be having to do mitigation on that one.
Yes. And just before we wrap things up, the last thing we want to ask is with the winter approaching and getting the cold and flu season, especially mixing with COVID, what do you recommend is the best thing to do or the best precautions to take going into this winter?
For the flu?
Yeah. Yes.
So the easiest thing to do is get your flu shot. They're available pretty much everywhere. Most pharmacies are able to administer flu vaccine. We know that that's a very effective tool. The predictions are that this will be a bad flu season. So if you haven't gotten your flu vaccine yet, I would strongly recommend that you get that done. And you know, of course, what we saw last year was that we had a less bad flu season, and that is typically credited with the fact that people were very consistently wearing masks and taking those other precautionary measures for COVID, which also work for flu. And washing your hands is always a very effective tool against flu. And then just taking care of your body, right? So eating healthy, getting exercise, getting fresh air, you know, making sure that you're watching the foods and the kinds of foods that you're putting into your body. That's your vessel that you carry with you.
Yes.
So that's important too, so that you can maintain as healthy of an immunity as you're able to.
That's a good thing.
Well, Director Heltz, we thank you so much for
coming.
your time.
Yeah.
If you guys like to subscribe to the AA Show,
Please do.
Click the button below and make sure to leave a like.
Thank you very much.
Yeah.